Dr. Fauci, maybe you can begin by giving us an overview of where things are at in the US. It seems like case numbers have started to come down, but they're still at a really high rate.
You know, it really is a mixed bag because as with Canada, we have a very large country and the infection viral activity really differs from section to section, state to state, city to city, county to county. So on the one hand, you have situations like in the southern states when we had the surge a few weeks ago, which was responsible for bringing up the daily cases from around 20, 30,000 per day up to 70,000 per day. That's starting to turn around and come down. So cases will come down, hospitalizations come down, deaths lag a bit by a few weeks. So you're still going to start seeing high levels of deaths. We're over 1,000 deaths per day, which is really, quite high and is quite disturbing. As those cases are coming down, we're starting to see the inklings of surging in other states like Montana, North Dakota, South Dakota, Minnesota, Michigan. So it's really an uneven. There's some good news and there's some sobering news because on the one hand, certain states are turning around, going in the right direction. And in the other states, what we're seeing is what's called an increase in test positivity, generally among young people aged 19 to 25. And when you have an increase in test positivity, namely the percentage of tests that you do that are positive, we have found that that's predictive that you're going to then start seeing a surge. So there's a considerable amount of concern in the United States now about what's going to happen over the Labor Day weekend. Because when you have a holiday weekend, following the 4th of July, following Memorial Day, we saw these surges coming up of cases. We hope that's not going to happen with Labor Day, but it very well might, and that would be unfortunate.
And I know the IMHE has just revised their model here in the past 24 hours to basically predict more than a doubling of deaths by January. I know that's just one model, but it sort of speaks to this idea of a big surge heading into the fall and winter. Is that still a big concern?
Well, it is a concern because, if you look at the background, the baseline of what we have, it's unacceptably high. So what you would have liked to see, like, for example, New York City metropolitan area got hit very badly. There was a period of time there where 50% of all of the cases and hospitalizations were coming out of the New York metropolitan area. But when they went up and peaked and came down, they are now at a very low baseline, like 1% or less positivity. But if you look at the country as a whole, our baseline is very, very high. And right now, it's about 30 to 40,000 or more cases per day. If we go into the fall with that high level of a baseline, then you add the risk of indoor activity because of the cooler weather, then we can have some significant problems. So that's what that model that we've just heard is based on, the confluence of events, of activity which isn't completely under control, superimposed upon going into the colder weather season that could be complicated and confounded by influenza, which again would be problematic.
I know a lot of Canadians are watching the situation down here in the US and they're very worried about it. And there certainly doesn't seem to be a huge appetite, for example, for reopening the border. But I'm curious, your perspective as a medical expert, is there still a benefit in travel restrictions? Do they serve a purpose at this point in controlling the spread of the virus?
In some respects, it does. I mean, if you have an area, a country as a whole, or an area of the country with very, very low activity, obviously there's concern about letting people in from the outside, other countries in which there's a high rate of infection. Sometimes it does have a positive effect of keeping the lid on things, but sometimes, it just doesn't make that much difference. So there is always this argument as to the benefit or not of doing that. People will still argue on either side of that.
I'm curious, have you been watching the situation in Canada or other countries? Are there things you're seeing in other countries that you think, gee, I wish we could be doing that in the US, or I wish public sentiment was going in sort of one direction?
Well, there are things that I see that worry me in other countries, particularly what I'm seeing in some of the European countries who did a really good job in some of the countries in getting down to a very low baseline. But as they are starting to try and open up their economy, we're seeing that troublesome increase and spike in cases. It's how you handle those spikes that are important, because inevitably, if you're trying to relax some of the restrictions in order to open up the economy, you are inevitably going to see cases occur. It's how you handle them. Do you have in place the capability of doing identification, isolation, and contact tracing? If you do, then you could prevent major surges as you try to open. If you don't, then you run the danger of seeing what we saw in some of our southern states. You might recall a few weeks ago, we had a terrible problem in Florida, in Texas, in California, and Arizona, which is now coming under control. But that was responsible for a significant surge that we saw a few weeks back.
So if you're in a jurisdiction right now that has low levels of case numbers or has sort of beaten this back once, what should you be watching for, and what should start raising alarm bells for you as an individual, for example, that says, hey, things are now trending in the wrong direction again?
Well, I mean, that's a great question, and that's exactly what I was referring to in some of our states, including, as I mentioned, Montana, the Dakotas, Michigan, and Minnesota, and places like that. When you start to see the test positivity creep up, for example, if the percentage of tests that are positive in any province in Canada or whatever is 3.5%, and then the next day it goes to 4%, and then a week later it goes to 4.5%, that's a telltale sign that you are really going in the wrong direction, that it is likely that you're going to see a surge. So when you start to see the increase in test positivity, it's time to hunker down again and say, wait a minute, are we doing the right things? Are we wearing masks? Are we keeping distance? Are we avoiding crowds? Are we making sure we do most things outdoors as opposed to indoors? Those are the kind of things that get triggered when you see things like an increase in test positivity.
It almost feels like there's sort of two different message tracks out there right now. On one hand, there's a lot of hope about a vaccine perhaps being ready, at least by the fall, and advances in therapeutics. And on the other hand, fears of a second wave, for example, and the rising rates that you mentioned. And I'm curious if that confusion, if you worry that that's going to lead to a sense of complacency among the public.
Well, the answer is there's always a concern about complacency, but I'm also equally as concerned about COVID-19 fatigue. I mean, it's not just the United States. Canada is in many respects in the same boat. Our European colleagues are experiencing the same thing. We've been going through this stress and strain, everything from the economy to interruption of regular services to just the fatigue of having to be locked down to a greater or lesser degree. Ever since February and March, it's now September, and we're still in that boat. So I'm concerned that people are going to get so discouraged, they're going to loosen up the kinds of attention to public health measures, which we need to continue to focus on if we're going to keep this under control.
When we talk about a potential vaccine, and there seems to be optimism about maybe identifying a successful candidate by the fall, but can you put that in realistic terms? Yeah. What does that actually mean realistically for rolling out at mass distribution?
Yeah, well, right now, if you look at the different candidates that are in various stages of testing, right now in the United States, there are 3 candidates that are already in phase 3 trial, which means they're in advanced testing to determine if it actually is effective, as well as accumulating more data on safety. Those trials are going to have, up to 30,000 people per trial. A couple of them are already 2/3 enrolled for the total endpoint of people that you want to get enrolled. At the end of the month, the beginning of October, there'll be another 1 or 2 candidates will go into trial. So there are plenty of vaccines in play right now. The projection is, and you have to be careful when you make projection because they're only guesstimates, they're not absolutes. The projection is that we will know whether we have a safe and effective vaccine likely by the end of this calendar year, November or December or the beginning of 2021. If in fact we do, and many of us are cautiously optimistic given the data that we've seen in the early studies, that we will actually have a vaccine that's safe and effective. You can start thinking about the deployment of that vaccine at the end of the year, the beginning of the first quarter, the first half of 2021. And as we get well into 2021, there likely will be enough doses for everyone who needs it, because the companies are talking about pre-making ahead of time hundreds of millions of doses.
Can I ask you, as things reopen, personally, given your expertise, just because we can do certain things again, are there certain red lines for you? Are there things you look at and say, all right, restaurants are reopened, but it's just not worth the risk? Are there examples like that in your own life?
Yeah, the things that we have seen in the United States that drive surges is bars. Bars where they are crowded, bars that are indoor. It's just such a perfect setup, because when people are in bars, they're drinking, they let their guard down, they take their masks off, they're crowded. I mean, anybody who's, at which I have been in bars, you could see sometimes they're 2 and 3 deep, people ordering over someone else. I'll have a refill on this, etc. It's such a perfect setup for a transmission of a respiratory-borne disease. So if there's one thing that we are concerned about, is when you reopen bars and you have crowded indoor bars, particularly if there's not good circulation. Restaurants you can control. You can say you're only going to let people in at 50% capacity or 25% capacity. You're going to try and favor outdoor dining. Those are the kind of things that are good. And then to do that, you'll lessen the likelihood of transmission. But it's when you have the crowded indoor bars that we're concerned about.
And would you say that sort of advice across the board, regardless of what rates may be in the community right now?
Oh, yeah, I think so. The reason is that things that are going on right now likely were triggered 2 weeks ago. And the things you're doing now are going to be manifest 2 weeks from now. So if you think that you're in good shape, you might actually not be in as good shape as you think you are.
And just on a final note, we've heard some pretty grim predictions for what this fall and winter could look like, coinciding with the flu season and perhaps a second wave of this virus. And I'm just curious what you see the fall and winter look like. Do you worry about a resurgence in places that have beat this back once? And really, what's your advice to people who may be suffering, as you've said, from COVID fatigue?
Well, my advice is that this is going to end, but don't be despair and throw your hands up and say, I've been through this so many times for so many months. I'm just getting tired of being careful. Continue to be careful. It will end. We will get back to normal. But if you let your guard down, it's not responsible to yourself as well as to society. So just try and hang in there, as difficult as it may be. In the fall, what I'm hoping is that if we adhere to the public health measures of wearing masks, keeping your distance, avoiding crowds, and trying as best as possible to do outdoor things versus indoor, as we get into the fall, I would hope that we would decrease the incidence of influenza, because the same things that you do, washing hands, wearing masks, keeping distance, the same things that you do to avoid COVID-19 are also going to help you to avoid influenza. So hopefully we'll have the secondary effect that we might diminish the burden of disease from influenza this fall and winter.
Dr. Fauci, thank you so much for making time for us. We really appreciate it.
My pleasure. It's good to be with you. Thank you for having me.